The issue of sedentary lifestyle is because human beings tend to be more lazy. That's why it's become the biggest risk factor in public health now.
Today, the Asia-Pacific region is facing rapid urbanizations that will have a fast impact to sustainability on our planet. In the other side, the urbanization can increase the sedentary lifestyle. Sedentary Behavior Research Network (SBRN) defines sedentary behavior as any activities involving sitting, reclining, or lying down that has very low energy expenditures. World Health Organization shows that the sedentary lifestyle is the one of the underlying causes of the non-communicable disease and the fourth leading risk factor for mortality in Asia-Pacific region. At the case among young people, it was also reported that 8 out of 10 young people don't get sufficient physical activity in the world. Meanwhile, 60% young population in the world are living in the Asia-Pacific region. Many reasons stand behind the sedentary lifestyle is high among young people. Research from Anthony, Amsterdam Public Health Institute 2017 reported that psychological, cognitive and emotional, behavioral, social and cultural, and physical environmental are some of the most common domains that lead young people to sedentary lifestyle. To engage young people, we should provide multiple approaches to merge the desire of doing sufficient physical activity, sufficient knowledge, and create supportive environment. By those problems, we propose the comprehensive solution that can avoid young people from sedentary lifestyle and changing their behavior to be more physically active. Our solution is called OHYPE, Organization Healthy Young People. We will use multiple approaches. There are 2 approaches. The first approach is social networking site, and the second approach is community-based approach. The social networking site approach will be providing a lot of information in an interesting way. We only select 4 social medias. The first YouTube, second one is Twitter, the third one is Facebook, and the last one is Instagram. Secondly, the community-based approach is actually providing young people the access to improve their health and change their behavior for those who are ready to change from sedentary. The key of this approach is actually running the advocacy part and various activities. In order to succeed this program, we have a long-term and short-term objectives. Our long-term program is to change the sedentary young people behavior to be more physically active and sustainable as well. And our short to moderate terms program as follows. The first, raise the young people awareness regarding the importance of physical activity by utilizing YouTube, Instagram, Twitter, and Facebook. Second, form the annual big events to empower young people around provinces in improving their health. Third, build the partnership to the several existing community to work with in promoting and running the OHYPE. The fourth, create the supportive environment in the urban city by doing advocacy to the potential stakeholders.
The question is, how can we change young people's behavior from sedentary to physically active? Because for some people, it is not easy to start making change, even though they realize that a small change will make their life better. Therefore, we try to understand that making a small change is not merely start with one dimension like biological or social influences, but there is another comprehensive theory which explains that the change is a long process. The theory is called as Trans-Theoretical Model or TTM, where it has been used widely for behavioral change intervention, and it has 5 stages. First is pre-contemplation, the second is contemplation, the third is preparation, fourth is action, 5, maintenance. Let's start with the first stage, which is pre-contemplation. In this stage, young people still don't know the disadvantages of being sedentary and the advantages of being physically active. That's why we try to raise the awareness of having healthy lifestyle. In this second stage, young people has already know the benefit of being physically active, but they still hesitant to start a new change. The third stage is preparation. In this stage, young people has been well informed about being physically active. Therefore, we will provide an information about nearby places and tips and tricks of being healthy person through our SNS. The fourth stage is action. Even though their previous behavior cannot be completely reduced, but they can track their process, still it is observable. The last stage is maintenance, where they have already gained their confidence and they believe by maintaining their new behavior, it will prevent their sedentary behavior to relapse.
Okay, right now I will be talking about the first year program and the second year program. In the first year, we will start to build our brand both online and offline. We will invite some of the public figure as a speaker, both in social media campaign or our annual event that will be in the form of a talk show. In the talk show event, we will also collaborate with some of the local sports community and encourage the audience to join us. We will measure the successfulness of the first year program by the number of local sports community that we engage, the public attention of the number and followers in our social media, and also the number of audience coming to our offline events. In the second year, we will focus to expand OHYPE to another urban area within the country. We will do it by conducting a short video competition in our social media platform for all young people in the nation about their inspiring story from sedentary to being physically active. We will choose 20 winners and invite them to the OHYPE annual event and train them to be a pioneer of OHYPE in their surroundings. The training consists of leadership, communication, and behavioral changing skills. We measure this program is successful by the new numbers of OHYPE communities that are being formed.
In the third year, we will make a big and fun meeting event called OHYPE Around the World. OHYPE Around the World will contain the marathon event, exhibition from OHYPE all over the country, and exhibition from sport community as a platform for them to introduce themselves to the public. At the end of the event, we will make a basic petition to the local government about modifying the city environment to be more physical activity friendly to their citizens. The indicator of our program is based on the quantity of the participant in OHYPE around the world, the quantity of the sign in the petition, and the consensus that we create between the OHYPE and the local government. We strongly believe that the success of the program is affected by the partnership. The potential partnership that we are targeted for global scope, just like United Nations Major Group for Children and Youth, ASEAN Youth Community, and also Youth and Sport Task Force. For national scope, we can take example from our country Indonesia, and we targeted Ministry of Health, Ministry of Youth and Sport, and also from non-governmental organization that is CISD, or Center for Indonesia Strategic Development Initiative.
Community monitoring and evaluation is carried out at least every community event. The indicators of success in monitoring and evaluation include: first, the time of participation; second, about the suitability of the program implementation with specified timelines; third is about effective communication to follow up sub-communities to ensure about the progressive of program implementations; fourth, about suitability of the budget and implementations of the program; and the last one is about documentation. Basically, the method in monitoring and evaluation will be taken by using quantitative survey. First, quantitative survey has function to determine the level of usefulness of each program held. The target of quantitative survey is participants of community event. Second, the quantitative survey will be taken by using SNS and determining about the hashtags. In this way, participants can give their testimonials about the event in the program. The hashtag will facilitate the screening of suggestions and testimonials from various SNS usage.
Now we would like to talk about the budget for our 3 years period program. For the annual talk show event, it costs $6,000 for covering the venue, speaker, and the booth as well. On the second year, we will have additional event, that is video competition, and also training program for the representative of selected team, with the total cost is $2,440 US, covering the accommodation for the selected team, winner prize, and also the training program itself. On the third year additional event, which is OHYPE Around the World, will cost $20,000 for covering the venue, hospitality, and the logistic necessity. Besides the annual event activity, we will also conduct advocacy every year, and the total cost is $6,000 US. And then for monitoring and evaluation, we will need $225 as the reward for the respondent of the survey. In order to massively spread our brand, we will do advertisement on YouTube, Instagram, Twitter, and Facebook. Each platform will be used 15 times during the 3 years of period, and the total budget for advertising is $435 US. With all of that, so the total budget for our 3 years period program is exactly $30,000 US.
We believe that being healthy
It's a lifestyle.
Let's move.